Thank you so much. We are so thrilled. There are so many people here. I'm Deb Kanai from Advocates in Action, and we are here today. We're hosting an information session for the Executive Office of Health and Human Services, EOHHS, and the Department of Behavioral Healthcare, Developmental Disabilities and Hospitals, Buddha. Can't say that 5 times fast. So Buddha is easier. And Buddha is where developmental disability services, they're underneath that. And so today is a session that is focused on to provide information about conflict-free case management, some updates about it, specifically for people who receive DD services and families. And so that's pretty much all I got on our end. I just would like to say that we are recording this. It will be available on our website and on the divisions on the BHDDH website. If there's any links that get mentioned, we will put those also there, so you don't have to worry about scrambling to write them down. If you have questions, there'll be time for questions and answers. So just hang on to it, and whoever's speaking will let you know, like, maybe you guys could just pause when you think it's time for questions, Brenda, just say, whatever you think. If you put them in the chat, Andrew Whalen from our staff will read them when you want him to do that. And please try not to use the chat to, chat because a lot, we want to make sure that everybody's included and not everybody reads. So we're here, and here we go. Oh, and Brenda, do you want to mention the in-person thing or no?
So sure, I will let folks know that there are some folks that have asked for an in-person meeting instead of a virtual meeting. And so it will be the same material that we will cover. But if anyone was unable to, for whatever reason, attend today, there will be an in-person session on October 30th. Let me think of the time. I'm trying to think.
1 to 2. You said the same time as today.
Thank you. Yep, 1 to 2, and it'll be actually in person at the EOHHS building on 3 West Road, at the Verks building. And so you have to register for that because we only have a limited number of seats just because of a space issue. And
we'll put information about how to register for that. We could put it up with the recording, or we can. Whatever works for you, but people will be able to do, if you want to do it with the thing that we just set up, then people could do it online. They can use that form just to register, or whoever you do, but you don't have that details yet, but you will soon.
Yep, and it'll be available on our website as well, once we post that. All right, so let's jump in. So hi, I'm Brenda Duhamel. I'm an associate director here in the Developmental Disabilities Division. I work closely with Kevin Savage. So I want to just start with just making sure that everybody sort of knows what we're talking about. So we've been working on developing conflict-free case management for a couple of years now. And just to make sure we're all sort of on the same page about what that is and why we're doing this. And actually, could you put up the slides, Deb?
Okay.
And these slides will be made available to all on the EOHHS CFCM website.
Do you want me to do it, Deb?
It's coming right here, and I'm not putting up the wrong screen, Michelle, because we just practiced, because I always have 2 screens, and yeah. Okay, here we go.
All right, so
you go ahead and here.
Go ahead. So I'll just start talking. So all states in the United States are required by the Centers for Medicaid and Medicare Services to create a conflict-free case management system. It's a Medicaid requirement. So the state of Rhode Island is a little behind in doing that. And so we are working with CMS, the Centers for Medicaid and Medicare Services, to create this system in Rhode Island. We are creating this system for everyone that receives long-term services and supports. So that is people that are on what people often call the DD waiver, and on the Elders and Adults with Disabilities waiver. Those are all the people that will be receiving conflict-free case management. Basically, what that means is that folks would receive case management that is free of all conflict, meaning that your that providers of a service cannot also serve as a case manager. So the federal government requires that we separate those two functions in case there could potentially be conflict if someone is writing your plan and then delivering those services, or assessing your needs and then delivering those services. So we have to separate those. That's what this is aimed to do.
So Brenda, the slides are up, so just let me know if and when you want me to advance.
So what I just said was on slide 2. Just put that up for a quick second. And then you can go right to slide 3. So today, what we wanted to talk about is get into a little bit about what the roles and responsibilities will be once we have case management, and how things might look differently when that happens versus how things work today. Next slide. So how individuals become eligible for DD services and how people are assessed, meaning how do we find out what your needs are, known as the SIS-A, the Supports Intensity Scale, those things will remain the same. Nothing will really be different based on case management for how that happens. So an application will still be required as it always has been. The DD staff here will process your application the same as they always have. You will go through that SIS process, same as you always have. Case management isn't involved at this point in time yet. Only after you become eligible, you get your SIS, and we understand what your level of need is, then you would be referred for case management. If you are already connected to a provider agency and they know you well, they can certainly be a part of your assessment process, as they always have. So often providers attend those assessment meetings with participants to help share what those needs are. So that will remain the same. Next slide. So this is just the words to describe the picture we just shared. I think this is what we talked about. You can go right to the next slide. So
I'm going to just tell you, Brenda, if you want any of those slides read, Andrew is a monster reader. If you need anybody to read them out loud, he's the person.
All right, great. I'm going to try not to read the slides like line for line, but trying to make sure I get to all the points. But I wanted to put it on paper so that way when if folks go to this later and then want to print it out, then they have that there. So you don't feel like you have to take as many notes. So, okay, so you go through eligibility, then you have your assessment. Then the next step is to get a plan developed. So you would connect, we would refer you to a conflict-free case management organization.
Someone would like to see slide 2 again in the chat. Do you want me to do that now, or do you want to just wait and the slides will be available afterwards? I'm just looking at the chat now.
Yeah, I think it would be best if we
keep going. Okay, so next slide.
Yeah, so you can stay on, we can go behind one slide.
Yeah, backwards. This is slide 7.
Yeah, no. Okay, yeah, I think we're good right there. So person-centered planning, that's the next step in the process. So the thing that's changed about that, here's where the change is. Right now, providers or independent plan writers create those plans with you. What the change is and what's required is that we have a separate party helping you with your person-centered plan. So you will you will connect with a case manager. The case manager will assist you with talking about what your interests are, what your hopes are, what your goals are. You will talk to the case manager about what's working really well for you, what may be not working so well for you. You will decide who should be a part of those meetings with you. And you are responsible for helping to talk to the case manager if you need some changes to that plan. The DD staff who in the future, we'll continue to sort of approve those plans, just like we do now. And if you are a youth transitioning into adult services, that caseworker would be able to participate in your planning meetings with you, because they may get to know you pretty well during that period where you're transitioning from school services to adult services. You can go to the next slide. Oh, maybe the slide before that one, actually. Before that one. Yep, can you go before that one? There we go. So the case manager's job will be to help you to create that plan. So they're going to sit with you, they're going to talk with you about your dreams and your interests and your goals, and they will be the one that help to put that on paper for you. But you drive the plan, just as you always have. They're really the individuals who help to facilitate that conversation and put it all on paper. So the DD provider, if you've been working with a provider, they will no longer be developing those plans, but they certainly can join meetings if you'd like to help you as you're talking about and doing your person-centered planning. Support brokers will have the same role as a provider. So again, they won't be able to write the plans. You'll go to conflict-free case management for that plan development. Now, what we hope is that case management agencies will need individuals to be case managers. And what we hope is that those people who do individual plan writing now, that many of those people can work for the case management agency and may still be able to write your plan. So fiscal intermediaries, again, won't be the ones submitting your plan. That'll be the case manager moving forward. All right, you can scroll through a little bit. Let's see. Let's go to the changes. So just to clarify some changes, again, the provider's not writing the plan, but they can participate. They will help share information if you wish them to be a part of those meetings to talk about, what they've been helping you with thus far. They are there to help talk about what services they have to offer and how they can help to meet some of the goals that you have. And they can work with your case manager if along the way some changes might be needed to that plan. So the case manager is, listening to you, helping you to decide which services you're interested in and which providers you're interested in. And again, we'll help make those updates to plans as you'd like them to, as you need them. So the next step in the process, you can get to the next slide, is then they're going to connect you to services and supports. They're going to make those referrals for you and help to make sure that you connect based on what you've decided when you were doing your person-centered planning. So again, you are still the driver. You're making the decisions. The case manager is really helping to make that happen for you. So you pick your services, you pick your providers. Our role, what the caseworkers here have been the ones making referrals for you in the past. They will no longer do that. They're just going to make the referral for case management for you, and then the case manager will go from there. The case manager will then make sure that you have information about what's available for you and provide you with those resources. Then they will make those referrals to providers, including a support broker and a fiscal intermediary and other referrals that you might want. And then they're going to make sure that you actually get connected to those services and make sure that you are receiving those services that are in your plan. And the provider will respond to those referrals, make sure that you are aware of what services they are able to provide, what they have to offer, and then respond to those referrals and let folks know whether they are able to provide those services to you or not.
Brenda, can I jump in for a second? One change with conflict-free is that the referrals they can make won't only be to DD providers. So if people are looking for other services outside of the DD system, the conflict-free case manager can help find those as well.
Thanks, Anne. All right, you can go to the next slide. This is basically the same information that we just shared, but as Ann pointed out, so they can help to connect you to other services besides just the developmental disability organizations. They can help connect you to a medical provider if that's what you need, social supports if that's what you need. So it's really, again, you're the driver and you're talking about what your needs are, and that's how the folks are knowing what to connect you to. You can go to the next slide. So the next piece that case management is responsible for in the sort of future is that they are going to help to make sure that you are getting what you wanted, what's in your plan. So still your plan, you're in charge. The case manager is going to be checking in with you periodically to make sure that you are getting the services that you want in order to meet your goals. And if you're not getting what you wanted or what you've developed in your plan, they can help to reconnect you, to make changes to your plan or address any needs that you have that aren't being addressed. So I don't want people to think that they are being monitored. It's the plan that's being monitored. So the role of the case manager is, again, to make sure that whatever you said you wanted in your person-centered plan is happening and happening to your satisfaction. So the state's role is that we are going to oversee case management and make sure that they are doing all the things that we are requiring and asking them to do for you. And the provider, your agency that you might be working with, they will also be helping to talk with case management to make sure that they are delivering what you've asked for in your person-centered plan. Go to the next slide. So just a few more details about this. So like we said, the case manager is going to be calling you, your family members, the providers, to check in monthly, really, to be checking in with you to make sure that things are happening the way you want them to. The case managers are required to work with you, to meet up with you once every 6 months, so twice a year, really, to check in with you in a face-to-face manner. That can be virtually, if that's what makes sense for you, or in person, if that's what makes more sense. You drive that. And their goal there is to check in on your progress, make sure that the goals are still what you want them to be, and that you're happy and satisfied with the services you're getting. And if there are changes that you need or any concerns, they can help you to address those. So the provider's role is to just make sure that they're delivering the services that you've asked for, and they can help to, if there are changes needed, connect with you and the case manager and coordinate to make sure that that happens. So in this monitoring role, the support broker and the fiscal intermediaries really won't change at all. So I know I went through that pretty quickly. I'd like to start with questions related to the content that we've shared about the roles and responsibilities of everybody and what, how things will look in the future.
And take the slides. Take the slides down.
Yep. And then I've got some other questions that I received through the mail that we can make sure we address as well.
So there were 3 questions in the chat so far. Andrew, did you see the ones that were in there?
1 minute, let me check.
There's one, the ones that are there. One was from Greg Warazak, beginning about CIS, and then
There are a couple of from him. He'd
Right,
like to see
so
slide 2 again, and he'd also like to know if a new CIS is going to be required.
So
the
is
one
this,
question. Yeah.
is this wiping the slate clean when this goes into effect? And so even if there's a CIS that's been done, that everything starts from square one to implement conflict-free case management?
No, so it is not a start all over and do it again. That will not be required. So if you've had a CIS recently, then that's the that's the assessment that we would utilize. If you've had a plan developed very recently, then that is still your plan. So you will not be asked to repeat things that you've already done.
And Brenda, maybe you could talk a little bit about who are the case managers, where are they coming from, and how are they going to be trained, and just the sort of the nuts and bolts of the way that you described it. It sounds like a promising change, but it's not so easy to see how this is actually going to be implemented.
Sure. So a couple of things. So one thing I would want to let people know about is on the EOHHS CFCM website, there are certification standards. They're in draft, but those are basically the requirements of a conflict-free case management organization. So I think you'll find lots of information there about what will be required of them, including training requirements and who those organizations can or cannot be. Who will actually be those case managers? Well, that's a good question. Once those certification standards next month go live, then we will hope to get organizations that say, we would like to be a conflict-free case management organization. Once those organizations become certified, they will be required to hire individuals to serve as case managers. We expect that many of those folks will be what we have now as people that do independent plan writing. They will hire those case managers, and there will be training requirements to make sure that they know and are able to do the things that we need them to for case management. So the state will provide much of that training, and the case management organization will also provide additional training to make sure that folks know how to deliver conflict-free case management in the way that we've asked them to.
Brenda, I'm just going to interrupt for a moment. There's a lot of people putting questions in the chat. So would you prefer that we look and call on people rather than it just filling up in the chat? Because it's like whoever types the fastest gets in there. And there's some people that don't type or read and write. So
Sure, we can do it that way. That works.
So people that have, if you've put a question in the chat already and you're comfortable reading it out loud, then you could do that. If you would rather have Andrew read it for you, that is fine also. But just to be fair and give everybody a chance to get at the table, let's try. So you might not have been finished answering Greg's question, and I apologize. I just wanted to make sure that people weren't feeling left out because they're like, what about my question? Because Pam Go's question was in there next. And then after that was Karen Sacco's question.
So Greg, do you feel like I answered your question?
Yes, I do. Thanks. I'd assume that there's best practices that Rhode Island can, from other states, that Rhode Island can don't have to reinvent the wheel and see what's worked other places and copy the good. Yes,
absolutely.
Good. Thank you.
So Pam, you were up next. Pam goes.
Okay, thanks, Deb. Really, my question was, early on, you had mentioned that the whole point of conflict-free case management is because you don't want the agency who provides the services to be determining what services are needed. But doesn't that also relate back to how Buddha does the assists to determine what eligibility a person has and then approves of those services? So isn't that kind of the opposite of what we're looking for?
So that's a great question. So the conflict that CMS requires us to address is between case management and services and case management and assessment. So the state can do the assessment because a separate entity is going to actually develop the plan. So that's where there's no conflict. So just like the case management is separate from service delivery.
But the state is going to determine from the CIS what a person can receive in services.
Right, and that is a typical way that states handle that. That's not the conflict. So the state determines you're eligible based on criteria, and then we assess your needs. And then once we assess your needs, we hand that off to a separate entity, case management, who then delivers your plan with you.
Okay, thank you.
Aaron, Sacho's question, I think it's Sacco, if you want to ask it out loud, or if you'd rather have Andrew read it, or Katie, I'm sorry, Katie.
It's okay. It's Katie Sacco. So my question was just about for case managers. You might not have the answer yet. Are those referrals going to be made through TheraP, or will those be, directly to the other agencies?
So the state will make the referrals to the case management organizations. If we have more than one organization, which we are hoping for, then the person would be able to choose which organization they prefer. And then the state would make that referral to the case management organization via a WellSky, which is a new LTSS system, a new computer system.
Yep, I actually meant how the referrals are going to be going out from case managers, because you said that they were going to be
the providers
with
So
services.
we are working out the details for how that will happen, and so I'd say more to come on that. We're working out the details for how that would work. But what we do know is that the case managers will be developing a personal profile, which is where we gather information that's important about the person based on what they share. And then the person-centered plan itself, those two pieces would definitely be shared with potential referral sources, based on who the participant requests we send those to.
Okay, thank you.
You're welcome.
Deb, you're muted.
Thank you. So where would I be without my, so I don't know, Greg, was your question answered about the case managers? Because your question was next about the, explain more, who are the case managers? How are they trained? I
I'm
think you
good.
asked that.
I'm
Okay.
good. Thank you.
All right, then the next person in the queue here was Kimberly Hedenberg. And again, Andrew will read it for you if you're not comfortable reading it. Just say Andrew instead of reading it. All right, Andrew, you want to read that one? I don't know if Kimberly's still here.
Kimberly Hedenberg wanted to know if you can explain more about the difference between a conflict-free case manager and support brokers and how they work together.
Sure. So support brokers are a service. So the case manager would refer you to a support broker if that's what you wanted. It's optional. And the support broker is there to help you to self-direct your services. So they will help you to identify who might be your staff, to help train that staff, address any concerns you might have with that staff. So they're really sort of boots on the ground with you to help you if you want to self-direct your supports.
That good. The next question, does Karen Schmidt, do you want to read it or do you want Andrew to read it?
I was wondering what happens to the support coordinators who are at the agencies now? Are we like done? I think we're all like kind of wondering when we're going to be given the pink slip.
Yeah.
That's what it kind of feels like.
So I'm sorry if that's the message that you've received. I think so that's really between sort of you and your agency. But what I would say is I feel there's still a role for support coordinators in that if you work for an agency, there's still coordinating to do related to that for that participant. So it might be the support coordinator in that agency that might be helping the person to work with the case manager and to make sure that that plan gets implemented within that agency.
So it depends on whether the agency wants to keep us or not, basically. So where do we find these new jobs? Where are they going to be posted for the, the new case managers?
So once we have an organization to do that work for us, they will be responsible for hiring staff.
Is it only gonna be like one agency who's gonna have all the, in charge of this? Is it gonna be like an office somewhere, like in Providence, and that's where we have to work? And then
So-
spread out to the state?
We're not sure yet. We are putting out a set of standards that say this is how and who can become a conflict-free case management agency. So we're not sure yet what those agencies, who those agencies are. That will happen over the next few months. And then once they become certified, then they will be responsible for hiring their teams to do case management.
Can I just jump into Brenda, just to say one quick thing? I think that, to Brenda's point, the providers have to decide, who their staff is and how their organization runs. But I just want to say that there are a lot of other things, daily things that support coordinators do in their jobs other than just writing plans and doing some of the stuff that's outlined here. So there would continue to be the need for those types of services, as Brenda was saying. But I really want to stress that point because I don't want everybody to think, oh my gosh, my job is going to be gone.
Brett, I apologize that Ann Peters had a question before, out of order. So Ann Peters had a question. If you were done with that one, I just want to make sure she knows we didn't miss her. Would you like Andrew to read it, Ann, or do you want to read it?
And I think you're on mute.
Okay, I didn't realize I could unmute myself. Sorry. My question goes back to it seems like we're building a very complex CFCM process with the layers you're talking about now. Where does this funding come from? Currently, there's a certain amount of funding from every individual's budget for this type of case management that goes to the agencies. It seems like a significant amount of money. And is it coming out of the individual budget? Is it a whole nother layer of bureaucratic funding or what?
So this is Medicaid and state funding that is covering this, and it is not a part of someone's budget. It is separate from that.
Okay. And the related question I had is slide 9 reference picking out your services before you even were assigned a case manager.
No, so it would be the opposite of that. So if you're brand new to the system, you would start by working with your case manager, developing a plan, and then the plan will help determine, with what you wish, which services and providers you get connected to.
Okay, and if we're so many people will currently be in the system and segue into this new process, how do you foresee that happening? Will they be starting off almost writing a clear ISP again, or what?
No, so if you have an active current ISP that you are comfortable and happy with, then that will be your ISP until until the 1 year is completed. So there will be no need to start new ISPs just because you've moved to case management, just because we switched to case management. If you are already working with a provider, it is very likely that the person is able to invite that provider to be a part of those planning meetings. So the providers can still be a part of those planning meetings. They're just not the ones writing the plan.
Okay, are we ready for the next question? Backing up here, and Claire, you're in the queue there, Claire. I don't know if you know your hand's still up, but you don't have to keep it up if you don't want. I know it doesn't get tired virtually, so it doesn't matter. But before you, Andrew, make sure I'm not missing any of these. I believe that the next one is from Mark Reinhardt.
Yes, that's right.
If I could just ask the question, and maybe I'm a little naive here. My son is self-directed, and I'm not really sure how this fits him particularly. Say, in the past, we've had a plan writer, a social worker, and the parents together And basically the parents have expressed what our needs are, and we have input from everyone, and we put that all together. Is the difference here now, instead of a plan writer, we got a case manager? Is that, or is there some other difference I'm missing?
That's pretty much the difference. Is that
And
is
the
that
ca-
instead of a separate plan writer, it would be the case manager that would develop that plan with the participant and their team.
If we have a plan writer that we're very happy with, is there a way to somehow continue with that person?
So there is a way. So if that person works with the case management organization, once we know who they are, hopefully that case management organization could potentially hire that person to be a case manager to provide those services for you.
Okay, but if I understand it, the case manager organizations are not currently in existence, but need to be developed.
Correct.
Okay, thank you very much.
You're welcome.
Andrew, I'm multitasking. Was the next one from Maria? Oh, no, it was from Claire. Claire, you're up.
Hi, Claire.
Yeah, hi. I've had a chance to look at the certification standards, and we've had many conversations with the DD community and with the larger LTSS community about the importance of person-centered planning, and the CMS, the feds are really saying that like you described, Brenda, person should lead it. They should be supported to choose their team and everything. But the certification standards don't seem to reflect that very strongly. They seem to be really heavy on reporting requirements, data collection, computer systems, even the training and the competencies for the case managers don't really stress skills in person-centered planning and supporting the person's communication. So I have a lot of concerns, not so much about what you're saying and describing today, but the way the certification standards are, at least currently. I'll be personally providing some commentary. I would urge others to read them and provide any kind of commentary. But I guess my question is how can we be assured that the entities that are going to get certified with these standards are really going to be training people in person-centered planning strategies that we all embrace?
So that's a great question, Claire. So first of all, I wanted to make sure that folks know that my partners at EOHHS are present on this call and listening to your voice. So we're listening and we hear you. If there are specific areas in the certification standards that you think would be that are weak in that area, we absolutely want that feedback around how to make that stronger. The second thing that I would say is that's not the only document. So that is where we are now with the certification standard for us getting a vendor. We are also going to be writing rules and requirements for those providers to make sure that what we're talking about today is what actually happens. And then there'll also be oversight. So a leadership team of EOHHS and BHDDH, we will be overseeing the case management organizations to make sure that they are complying with all the requirements that we're putting forth. And we'll be doing that in an ongoing way.
So just to be clear, and I think the regulations, the standards actually referred to regulations and requirements. Are they available? I mean, for anybody who would be applying to meet these standards, if they're not, the other things aren't published yet, how are they going to even know what they are?
So when we write the more sort of the rules and requirements, that's more specific about how we want the case management entities to do their business. So we feel like that's where we'll be able to get into more detail about that. So, and we're in the process of developing those now.
Okay, thank you.
We didn't see any other questions in the chat. I just want to if anyone's here, especially people who,
Actually, excuse me, Deb,
yeah,
there is a question from Maria Kamel, I think.
okay, just before you read it, I just wanted to say that, and then Andrew, either you read it or if that person wants to ask it, but so the meeting is specifically, if you're someone who receives DD services or a family member, and there's no wrong question, you can't ask a bad question. So even if you thought somebody already asked it and you're still sitting there saying, wow, you know, this is a big change, and change can be scary, but it doesn't have to be. But one thing to get past the scary part is just information. So this is a big opportunity for people. And if you think of a question afterwards, you can send that and we'll get the answer for that for you also. But there's no bad questions. And so if you have any questions or just concerns or comments, raise your hand and we will get you up there. So go ahead, Andrew, sorry, or whoever that person, if they want to read it.
Yeah, Maria Kamel.
Yes, good evening, or good afternoon, I should say. So my question was really regarding the plan writers. So many of parents have been on these journeys for many years and have plan writers that have been participating in these transitions for years. And now we're left to hope that they will be taken on by a case management service and trying to seek them out to see if they're still out there and hopefully have them participate in, you know, future changes. But where does that leave the individual? You know, these are very complex cases, very, you know, complex needs, and these plan writers have been very familiar. So in my sense, it's like going to a doctor and having a doctor for 18 years and now losing that doctor and having to start all over again. It takes a while for these individuals to really be familiar with the needs of the individual. So now is this a whole do-over in hopes that we will maybe have a chance in having the same plan writer if they picked up by a case management service, but if they're not, to have to start all over again, where, you know, right now between the social worker and the plan writer and the agencies, you know, everyone already is familiar with my son as well as other participants on this meeting. So how does that play out? Is it a do-over that now we have to hope that the person after receiving training will be brought up to speed very quickly and have a crash course in each individual and really have a well-rounded understanding of what their needs and their you know, desires are?
So I think what I would say to that is, first of all, we do hope that folks who currently now do independent plan writing get hired by the case management organizations. That would be the best case scenario. The person can continue to work with folks that they know well. That would be ideal. Participants can invite whomever they choose to be a part of those meetings. And so if they've been working with someone who was their plan writer who maybe doesn't want to, you know, work as a case manager in the future, it doesn't mean that they can't still be involved and support and assist that person to meet with the case manager and sort of transfer information. So it's not a desire to exclude anybody, and participants can certainly invite you to participate and assist them.
Would
Well,
that person be compensated, you know, because again, you know, we all go to work every day in hope of some sort of, you know, compensation. Would that be something that we would be at the mercy of that person wanting to participate on a voluntary basis, or is there that compensatory component in there?
I guess that would depend a little bit on the role. So if it were a family member, for example, participating in those person-centered planning meetings, then there's not a way to pay for that. If they are a support coordinator and they participate in a person-centered planning meeting, then you know, as a provider, there is still reimbursement for that. So I think it really just depends on the role.
Because you can understand as, you know, a parent and many of the individuals on this call, you know, these are long processes. And when we're dealing with individuals that have ongoing changes. So it becomes extremely crucial to have someone that has that full understanding of that individual's needs versus reading a quick summary in hopes that that individual is going to get a good picture of the individual that they're assisting. Does that make sense?
Yes, and person-centered planning is designed to be an in-person, meeting where there's conversations with the participant, whoever the participant invites to help them. So it's certainly not, just answering some questions and plugging it into a form. It's meant to be a conversation and getting to know people.
Okay, thank you. Hopefully this will be an easy transition for, the parents and most importantly for the young individuals.
Agreed.
There was a question that Andrew, did you see that? Somebody wanted you to read the next question.
I'm looking at it right now. Stephanie Blair wants to know, will the plan writer who will become case manager be paid twice from our individual budget?
So case managers, that work will not be pulled from the person's individual budget. That funding is separate. And everybody gets access to that.
One quick question was just when will conflict-free case management go into effect? That's just a quickie, so I figured I'd just spit it out.
Yeah, that's not as quickie as you think.
Okay.
We are working as quickly as we can. We want this ready to begin as soon as we are able. The certification standards are out for public comment now and through the end of October. The next step in November is to post them as formal and final certification standards. Then we will be working on training and making sure that we identify who those organizations are going to be. We are going to provide or develop a training plan for those new folks. And then we will begin to start. So a lot is dependent. We're sort of taking it one step at a time. But our goal is definitely within the beginning of 2024.
The next person, Christine, I see your hand is also raised, Christine Ferris. So do you want to ask out loud rather than reading it or having Andrew read it?
Yeah. Thanks, Deb. I appreciate that. Sorry, my hand icon was going a little wacky there for a minute, but I wanted to speak to Maria and her concerns. I have a lot of experience as the conflict-free case management person. I did this for years, and Maria expressed concerns that are absolutely valid about having someone who's really integral as part of their person's support team. And as Brenda said, that person can absolutely attend any meetings that you have. And that's something that I notice here with people that self-direct. The meetings are often only the family, the person, and the plan writer, when it should be, actually, in my opinion, it should be the whole team that's supporting that person. The behavioralist should be there, the support staff should be there, someone who knows the person well should be there. Everybody can add something to the richness of the plan and fomenting goals for that person to help them have the best life. So absolutely, Maria, you're right in your concern that, if you have somebody who's very important to you and your family, that person, if they choose not to transition over and get hired on someplace as a conflict-free case management person writing a plan, they can certainly attend and give input to support your loved one.
Thanks, Christine.
I have a comment, question.
Whoever said that? Oh, Kenneth Sebesta, go for it.
Hi, am I live?
Actually, Jeff Christie, but
Oh, I'm sorry, Jeff, you're after Ken. I thought it was you. So Jeff first, sorry.
How can a plan writer become a case manager? Like, how do you choose
So
whether or not?
When we have case management up and running, which we don't have yet, but once we do, then they will be recruiting and hiring case managers. And so then we would encourage those independent plan writers to apply with those organizations.
All right, thank you.
Brenda, you had said at one point, or someone had said, just to clarify, like, that if you get a case management person and you don't like them, you can change it, right? It's not like it's in stone, that's it, that's your person.
Right. I think if you were working with, so first of all, I hope that our goal is that we have more than one conflict-free case management organization. Might not happen at first, but we hope along the way that happens. And then people will have a choice with different case management organizations. Within that organization, if they assign you a case manager and there's a concern or it's not working out so well, yes, you would be able to request a different case manager from that case management organization.
Pam goes, you're next in the list of questions,
Okay.
people asking questions.
Okay, thank you, Deb. Okay, so suppose I'm a plan writer and I apply to one of these new agencies to become a conflict-free case manager. I have kind of two questions. One, would I be able to keep the folks that I've been writing plans for the last 8-10 years? And B, I know that the standards say each case manager is going to have 40 people on their caseload. So I would need to add more people to bring it up to 40 and become more of a full-time worker?
Not exactly. So let me clarify a little bit. So we don't have the organizations yet. Once we do, so the thing about the 40, we have designed it to be that our expectation would be that case managers have approximately 48 individuals on their caseload each. That's not a requirement of case manager, but that's how we figured out what the rate of pay would be. And that's what we believe makes the most sense based on how much time we expect case managers to be spending with individuals over the course of a year. It will be up to the case management organizations about their hiring and who gets assigned to who. It would make sense, certainly, if you worked for an organization and you work with these 6 individuals, for example, and they all decide that they want to go to that case management organization, that would make sense that you would be connected. But I think that that's something that you would work out with the case management organization.
Okay, thank you.
So Kenneth, you're next. Sorry about that.
Yes. What I would like to say is, I'm listening to all this and I'm a parent of a handicapped person. And I'm hearing a phrase that sounds like it ought to be something good, which is conflict-free case management. And all I'm hearing from this meeting is we're getting another layer of bureaucracy dumped on us that doesn't help anything. So it's really frustrating. I don't hear anything here that's going to help me get staff people when we have a hard time getting staff people. I don't hear anything addressing the real problems we've been having. I hear another layer of bureaucracy that the outside is imposed on Rhode Island, and all those people on this call are having to find a way to try to cope with it. And boy, that's frustrating. And that's all I have to say.
I agree with Kenneth completely.
So I'm sorry that folks feel that way. I hope that, the reason that there's many reasons that we're doing this, but one big reason is that our funding source, how we pay for things, is requiring us to do this.
We hear it.
So and every state is required to do this. So not just Rhode Island, it's happening all over. And really what the requirement is for a separate party to do the planning and connecting to services. That's not the way our system works now. So to us, that's the added value, is that there's less risk for steering or for bias. Not saying that happens now, but that's what the federal government needs to protect individuals from. The other thing that's new to the system that we believe is beneficial is the is the monitoring of that plan, making sure that people are along the way getting what they said that they wanted and needed in that plan. This will give us the opportunity for individuals to be sort of paying attention to that plan along the way and checking in with folks, the participant, the providers, to make sure that things are going the way everybody wants them to. And we didn't simply create the plan in the beginning and then not pay as much attention to it over the course of the year. The plan is really what drives the services and supports, because it's what the person is identifying as their needs and wants. And we need to make sure that that's indeed happening.
I think if I could,
Oh, sorry. Yep.
sorry. I think if I could jump in here too, is part of the point of conflict-free, in addition to everything Brenda said, is to make sure that people aren't also just being siloed in one system. If there are other services they need, making those connections outside of the system too, in other services that are available to them.
So Maria Camo.
Can you give an example of that, Ann? Like,
For example, if people need food stamps or are looking for other types of connections, that the
What if people are looking for something different to do during the day? It's not a DD inside thing.
so it might hook people up with senior centers or with other things. So it's looking at the person's needs and then finding the services to help support them. So if the services don't already exist within the DD system, it could be letting us know that we need to develop them or looking for where else those services could be found.
okay, thanks.
All right, Maria, are you still here?
I am, thank you. So just so that I'm understanding this and processing this correctly. So in the case where there is currently a plan writer that you are satisfied with, is the hope that they will, if onboarded under the case management program, will they kind of let us connect and make us aware of what agency has picked them up so that we can continue with that? And I can understand there are, concerns for individuals that maybe might not feel that their plan is correct. And maybe this is an option, as you said, to kind of have additional things put forth, to us. So I think, is it something that they will try to make this transition as easy as possible in connecting the current plan writer with the case management and then letting us know? So say, for example, in my son's case, it's Beth. So, hey, Beth has been picked up by ABC Company, and now she can continue to provide services to Adam, who's my son. So is that going to be the case? And we will be informed, or are we on a search to figure out where she has gone in hopes that now we can make that connection?
So I think our goal is certainly to be as least disruptive as possible to everyone's lives. If it makes sense that, as you said, Beth is the plan writer and say she, works for case management agency ABC, I think it would be important for Beth to talk to the case management agency about those folks that she currently provides, plan development for. And if those folks are referred to that case management organization, it would make sense that's what would be coordinated. That would be the case manager assigned to, to work with those folks. So that's absolutely what we would like to happen, is that those folks can continue as much as absolutely possible.
Okay. I mean, it seems understandable that if there's a gap or a deficiency and there are additional services that could be provided, I'm sure under this new case management program, these individuals will be also guided as to what additional services, so that if they're not aware of right now, they will be educated on additional things that might be available to individuals
Right.
in need. Okay.
Yeah, I think to think about, one of the benefits of the system and moving forward is that, and not that this is good or bad, but I think sometimes right now, the way that our system works is the first step is to find a provider, right? Often. And then you create a plan. So what will happen in the future is that you'll create your plan first, figure out what you need and want, and then connect you to a provider. It may make sense that you're connected to different providers for different things, versus getting connected to one provider and then that provider writes the plan. And maybe or maybe not, of all the other things that are possible. So by starting with sort of somebody in the middle who isn't a provider, by saying, just tell me all the things that you need and want, and then we'll connect you. You may connect you to provider A around employment supports, may connect you to a different sort of provider for a different sort of service. And so by starting with the plan, that's what the focus is. What does the person need and want? That's the starting point.
So you mentioned that Rhode Island is one of the last on board with this transition. So based on the past transitions with other states, has this been semi-smooth? Has it been extremely bumpy to transition through this new case management service? What has been the feedback that Rhode Island has heard from states that have already transitioned into this new way of planning?
I mean, I guess what I could generally say is it's very widely varied. Every state is sort of still in the middle of doing this transition. And every state has managed that different. Every state's developmental disability system works differently. So it really gets hard to kind of compare because it's not apples to apples necessarily, but we are doing a lot to try to learn from other states what's worked well, what hasn't worked well. Trying to make sure that stakeholders are in the loop and providing us with feedback and having these conversations all along the way is one of the things that we've learned is very important. And we continue to work with, we have some folks that are helping us that help us to find out how other states do things, to make sure that we are trying to use best practices and learning from other states about how to best make this work for folks.
Perfect. Again, I think you're hearing from the parents who have joined in, we have such struggle just finding staff and just many other things that we're navigating day to day. And, to think that there's another change that will just kind of complicate things is very unnerving because, we struggle with just the basics of getting the help that we need to position our children for success with this direct support program. So I think that's where all our nervousness comes from.
Completely understandable. It's a big change and change can be scary. And as you know, there's a lot of things happening in our system that's changing, hopefully things for the better. And so there's a lot going on to really work to make the system work better and smoother for everyone.
Andrew, the next question, the one I just sent you is the next one who's up. You can still see that. And then Dory wants you to read hers also after that.
Okay, will there be a need to continue to write both an ISP and a PCP, which is a person-centered plan? There appears to be a lot of duplication of information in both documents.
So an IEP, an individual education plan, I think.
Excuse me, Brenda, it's not, I said ISP, not IEP.
Oh, okay. So no, it's a different term for the same thing. So your person-centered plan is what now we call the individual service plan. So you won't have both, you'll only have one.
Can I just to clarify that you do a person-centered process, that seems like the thing you do before you pick the agents, all that, and then but it's all just kind of one of the same thing with different phases, kind of.
And we can continue to call it the ISP.
Yeah, different names and this and that. Yeah, okay.
Yeah. So you go through a person-centered planning process.
Okay.
At the end of all of that, you get a plan.
It should be person-centered. Okay.
Right, so we're sort of calling it
Alright.
the person-centered plan, but
All right.
for ISP.
As long as it's person-centered, you can call it kumquats. It doesn't really matter. All right, Andrew, and then Dory had a two-parter there that she'd like you to read.
Dory Carter says that she can understand this needs to be done for DD agencies, but how is this person-centered for people who self-direct? An independent plan writer has no connection with the client that would create a conflict, unless I'm mistaken.
Not exactly clear on the question. I think, so conflict-free case management, so it, as we've said in the beginning, is a requirement. It's not so much that an independent plan writer has the same degree of potential conflict as, maybe an agency would, but there are other requirements under conflict-free case management that aren't met by an independent plan writer. Things like, we will have one system for everything to make sure that things get coordinated. The part about the monitoring piece is also a sort of something very new in our system, to be connecting with individuals on a monthly basis and checking in, and making sure that we're along that way collecting information that we need for our federal reporting, to show that this is what we're doing. So there sort of, it's bigger than just the conflict about a provider writing a plan or a provider doing an assessment.
The other part there, Andrew, I think that was actually from Andrea. She put that one was actually from her. So Andrea, do you want to read that your question, or have Andrew do that?
No, I mean, basically it's the same question. I just am a little confused where it's two separate jobs, right? Writing a plan and having all the resources and knowing how to write the plan and what goes into a good plan, and having someone who's done it and familiar with the family for a while. So that's a job, and that's a job I do, and I do well, so I've been told, and I do for many clients. And so there's a difference between that and case management. So there's a lot of managers that cannot write plans well and accurately and thoroughly. And there's a lot of plan writers who don't necessarily want to manage. It's just a different animal. It's like two separate. So to require all the current plan writers that do their job, know their stuff, know the system, have been doing it for years and years and years, to just accept two jobs. Why can't there be a conflict-free case manager who hires case managers and have plan writers? Like, why can't there be two positions instead of requiring the current people to switch their whole life and become a manager, which they might not even be good at managing?
Well, I would say because in the requirements from CMS, it speaks, the way that it defines what case management is it consists of four basic things. It's gathering information, developing the person-centered plan, making referrals and connecting people to services, and monitoring the plan. So the federal government, when they say case management, they mean all four of those things.
So one person has to do, I understand that all four of those things have to be done. So one person doesn't necessarily have to do all of those four things. I do everything. I do the last three of those four, and every plan writer I know that is good at their job does the last three of those four. It's just the monitoring that, most of us do not do. So I understand that they both have to do the guidelines say they have to all those four steps have to be done by the same individual.
By the same organization.
Right. But not necessarily a plan writer. A conflict-free case manager could have case managers that monitor and have plan writers as well. No?
the case management organization could have different people that do the different parts of case management. I'm not sure that that would be not allowed.
Okay.
That would be for the organization to figure out what makes the most sense for
Gotcha.
everybody involved.
Okay, thanks.
Ann Peters. You want Andrew to read it, Ann, or you want to ask it? I know it was there a while ago, but we're going through them.
Hi there. Yeah, I think these last questions relate to my question, which is unreasonable expectations on case managers if they're expected to handle 48 cases and presumably become familiar with the individual's needs as well as the opportunities in the various communities and such. And that this is including time for 2 annual meetings as well as thoughtful monthly check-ins. I think that's what a lot of the concerns that are showing up in these last several questions. And one of the other questions that seems related to this is, how do you find the agency if you're working with a case manager, given the capacity issues that so many agencies are having currently?
So it is true that capacity wise for agencies and finding staff, this doesn't resolve that. It's a sort of a separate matter. Making sure that we have enough providers with enough capacity to serve our population is, sort of an ongoing thing that we're working towards. I think the discussion about the caseloads of 48, that's how we calculated the rate of pay for the case management organization. And our next stakeholder meeting, our next large stakeholder meeting in October, I think October 26th is the date, we're going to go into a little bit about how we came up with that rate, and it'll show what the expected amount of effort is around each of those services by the case managers to show why we got to that 48 number. So it'll show, for example, in the 4 different stages of case management, gathering information, doing the plan, connecting to services and monitoring, how much time we assumed on average that it would take for people to do that work, sort of broken down in the different areas per person. So I think that will help to answer your question. So I'd encourage you to participate in that meeting.
Brenda, is that the one on Thursday, the last Thursdays of each month? Because we can put that in the EOHH does.
Yes, that's the October 26th meeting. I think it's at 10 o'clock. That's the one.
Okay, we can put the link for that in the chat for people, and we'll put it on the website.
Yeah, and that's also on the EOHHS CFCM website. All of those larger stakeholder meetings are there as well.
Christine Ferris's hand was up. I don't know if you fell asleep, Christine. You've been waiting patiently, but you're up if you're ready, if you want to ask another question. And then after that is Jean DeSimone Malone.
Thanks, Deb, for getting me. No, I haven't fallen asleep. I've been taking some notes. There's a lot of conversation here. It's going pretty quick. I noticed that there are a lot of concerns about the change that's being implemented. That's normal. Somebody asked about how this happened in other places. I know that when I was doing this work previously, now it's been 25 years that the state has been using conflict-free case management. And in the beginning, it was bumpy. The agencies had a little difficulty getting their head around it. And after about 10 years or so, everybody realized, hey, our support coordinators are free now to do other things, which was beneficial to everybody that was on board asking for supports. So that was one really good outcome there. You were mentioning about why have a conflict-free case management, really what is the benefit? And the conflicts, as someone has mentioned, are often hidden biases you don't even realize you have. So you have somebody outside kind of looking in from a different angle. Also, plans, I noticed, tend to have the same goals for year after year after year after year after year. That really isn't working. That needs to be tweaked, and the conflict-free case manager might help that change. Also, some people for example, I saw a plan where the parents wanted the person. This person likes to watch cartoons, and the guy's telling me, no, I want to watch Westerns. So, you know, I had to intercede and help the family recognize that this person really didn't want to watch cartoons anymore. So, you know, it's just someone else, another layer of advocacy, another layer of support. Everybody here on this call are very, very involved in their person's life, but there's some people that just are not for some reason. And this might be very beneficial to them particularly. Someone mentioned about the caseloads being high. I think, Pam, that was you. 48 is a lot. My experience is that we were capped at 30. Occasionally we would do 32 or 35 to cover if somebody was out or there was a shortness amongst the staff for some reason, but that was a lot. It was full time at 30 to meet the needs that we, you know, and the standards that we were working under. So I just want to toss that out there too. Thanks.
Excuse me. Are you saying that there are people whose goals are to watch cartoons or something like that? Is that what
yeah,
you?
well, it wasn't really a goal. It was more of this person likes to watch cartoons. And so the goal was that they would select what they wanted on the television. That was a goal, to use a switch to select what they wanted on television. And the family always had it on cartoons. And the fellow's telling me, I don't want to watch cartoons. So we had to make that switch in the family to get them to think, you know, this fellow wants something different. Let him have what he wants. So that's where I came in.
That's a good example of like having a choice when there's a limited choice versus like opening the options. Like here's more choices than just cartoons. The next person was Jean DeSimone Malone was the next person.
Hi, my question had to do with if there are more than one conflict-free case management organizations, will parents, individuals, families get to choose one? And will they be told, okay, here they are, here are these 3 conflict-free case management organizations, you can select one. And as an independent plan writer, if I was hired by one of them, can I kind of, verbally tell the parents, well, listen, I was hired, I think we talked about that earlier, I was hired by ABC. So if you want to continue to have me as your plan writer, which many parents have, talked to me about already, then select this ABC organization. Would that be?
Yes, so people will definitely, if we have hopefully more than one conflict-free case management organization, then yes, we will at the state, we will be asking and informing people about their case management options. And then they will self-select that, and then that's a case management organization. So if they're aware that you work for organization ABC, that they want to continue to work with you, then that would make sense, that would be where we made that referral.
Okay, all right, great, thank you.
You made me think of a great idea that might make sense for the case management organizations to sort of identify who their case managers are. That might be helpful in having a person to decide where they would want to get their case management from.
Yeah, and Brenda, would it be like, I don't know, a conflict, I guess, if you will, for me to say to organization ABC, hey, listen, I write plans for these 100 people. So, they all said they want to keep me. So go to ABC organization, or is that?
Yeah, I think there would be ways to figure that out in a way that,
okay.
again, we're trying to make things as least disruptive for people as possible.
Right.
And if relationships have been developed and formed over a period of years, that's not our goal to disrupt that. So yeah, whatever we can do to make that continue is what we're going to work to do.
Okay, great. Thank you.
There's only, yes, Greg, the meeting ends at 2:30. So there's only a few minutes left. And there is one more question. Did you answer that, Maria? You want to ask that one or have Andrew read it, or one more about changes?
So no, just a quick question in regards to, I'm assuming that these processes don't happen overnight and they have to wait for the conflict-free manager agencies to be certified. So if this process is slower than anticipated, will things stay status quo until then, even if it surpasses, if they want this to go live January and say next January, they're still looking at that, or is this a time crunch? Like this has to be turned over in the state of Rhode Island by XYZ time?
Well, a little of both. So yes, we are a bit of a time crunch and we need to make this happen as soon as we can. But until we have that case management entity, there's nothing that would necessarily be different. So that's why we are working to get this implemented as soon as we can.
On a related note, Karen Schmidt just asked the same. She said, what happens if you don't get enough plan writers? So the same idea.
Yep, no, and we are looking and considering like how to handle the different risks. What if no one decides they want to be a certified conflict-free case management organization? We need to figure out how we will handle that, and we're constantly talking about all those risks and how to potentially address them. But we as a state of Rhode Island do not have a choice in implementing conflict-free case management for our long-term services and supports population. That is a must. Can
I just say that we focus so much on having plan writers and agencies do these things for people, but people can put a little more, it's your life. So you can think about what you want in your plan and start to put it together and go to somebody and say, this is what I want. It's instead of just being on the receiving end of somebody saying, here's a plan for you, take charge of it. And that'll get you a little bit closer to where you need to be. And also just those meetings that you mentioned that EOHS has those are, I put those in the chat. And if you also go to the EOHS website for conflict free, which I put in earlier, but I'll put in again, they have previous meetings recorded and stuff. And so if you want to do all the research and things, and then the certification standards are there also. Are those are drafts. So people were having some issues. You can comment on those, right?
Yes, that's what they're there for. Right.
I'll put the links back in again. All right.
So we are getting feedback, as we speak, and I believe those will be up until October 31st. So it's still open for feedback. And there's a website. I don't remember what it is exactly, but it's right in there, so that right on that website. So you can add feedback or comments directly to that, so that the whole team receives that information.
There's an email address there. I'll put that in there. I'm looking for the website, but there's no other. So if you want to call on more people, there's no other questions in the chat right now, unless Andrew, did you see any other ones or Michelle or?
Yeah. I think there's one from Karen Schmidt, although I think that one was covered. She asked what happens if you do not get enough plan writers, but I think we talked about that.
So is anybody, especially if you're someone who receives DD services, like we said earlier, there's no wrong questions. So if you have any kind of questions, or you have some concerns, you hear something, you heard a rumor and you're like, what about this? This is a great time, a safe place to ask it or say it. So nothing's, there's no bad questions. So if anybody has anything they want to say, this is it. I'm typing links in the chat, so if somebody else can.
So there's a question, did any agencies apply yet? So no agencies have applied yet because the certification standards are not final and formal yet. They're still just out for public comment.
Yeah, could you put up the last slide? There's an email on there, so if people think of things later, they can contact us. This isn't your one and only opportunity.
And Kenneth, I think you
There's
had your
one for
hand raised.
BH. There's one for BHDDH for DD specifically, Deb, on our last slide.
Hold on, this
People
window
can
got
always
closed. I'm
comment to
opening it again.
OHS.
Yep, just hang on. I'm putting it back up because it went away.
Kenneth, jump in there. Go ahead.
Yeah, hi. A different matter. One of the services we need is reliable transportation. And one of the directives we just got this last month is that mileage would no longer be paid to a family who owns their own van. That's just totally counterproductive for what we need for good transportation. And that's really sad. So I just want to put that out for everybody.
Andrew, can you read that slide for people that don't read it, please?
Sure. Contact us if you have any questions or concerns. Email is www.bhddh.askdd@bhddh.ri.gov.
And there's another question in there, Julie DeRosa, do you want to ask a question?
I'm signed into Julie's account. She didn't ask the question. I'm asking it. So with this new conflict-free case manager, if someone in the person-centered plan wants a service that is not provided by a Buddha licensed agency, can their flexible budgets be used to pay for that service?
Anne, can you take that?
People who self-direct can pay for certain other types of services. They do still have to be Medicaid eligible services that are in a person's plan. So we'd have to look at those on a case-by-case basis. We are working on some improved guidance around what types of services can be used under goods and services. So that should be out soon.
So if it's goods and services, they would have to have a fiscal intermediary?
Yes.
Where are the slides located again, please?
We will put the slides on our website, on Advocates in Action website. And Michelle, we could probably send them to everybody that's registered also. We can shrink them down to something small. And so if you're here, we'll email them to you.
You have the PDF to.
Please, thank
Yeah,
you.
we'll email the PDF.
Yes. They'll also be posted on the BHDDH website and the EOHHS website.
I would really encourage folks to go to, as often as they can, the EOHHS CFCM website, because that's where all of our materials for all of the meetings get posted and where information about upcoming stakeholder meetings are kept. Most of our presentations are up there with recordings. And so it's a great place if you're coming in at this and you hadn't been in any previous meetings, that might be a good place to go. And we're creating new documents and things for people to review and look at and putting up on the website pretty regularly. So it's a good place to get information.
And if you forget what it is, we do have the link from the BHDDH website. We link directly to it. If you look at the conflict-free page that we have, we link to that page.
And I would
But they do
encourage
have all the.
I was just going to put in a plug for your newsletter, and that the DD newsletter, we try to make sure that we are providing updated information there for folks. And the link is typically there for that EOHS website as well.
Did you say that there is a website to submit your feedback? Because on the EHS site with the certification standards, I see an email address, but I don't see a website.
No, it's an email address.
Okay, all right. That's in the chat.
The only question that wasn't answered is Robin Jean wanted to know, when do we expect to have those finalized? And I think she was referring to the standards.
Yes, I believe they are posted right now through the end of October for feedback. Once then we will be collecting all of that feedback and reviewing the standards to make any potential, tweaks or edits to that document. And then they will be posted as final at some point, hopefully early November.
Someone just emailed Esther, email Esther Picone, just email and said, if somebody doesn't have computer access, how will they be able to get support around this? And I know, Brenda, you mentioned at the beginning, there'll be an in-person meeting on October 30th.
Yes.
And I think, people can still call their case managers at their social DD social workers, right? Is that one of the answers, or what's the answer?
Sure. So there is an in-person meeting, so we would encourage people to participate as much as they can. And so the in-person meeting will be on October 30th. It's basically going to be the same thing we did today, but just an in-person option for those folks who that works better for them. And so I would encourage folks to participate in that. We do have a limited space for that meeting though. So we are only able to accommodate about 25 participants. So again, it's really for folks who weren't able to participate in this meeting, but really want to, and in person is a better option for them.
And the Ask DD website, email address that Ann had mentioned, they can send questions. I mean, that's email, but you know, if you do have questions, this is not the only time and place for the information.
Correct.
One person, oh no, that was, you already answered that. Okay. Any other questions? Anybody or concerns, or anybody hear a rumor and they're like, oh, is this true? I mean, there's no bad questions or comments that you could make right now.
There is another comment for people down the road. If people cannot make the meeting and don't have internet, will there be mailed info? Yes, we are planning on doing a mailing on a lot of the changes. And once conflict free is rolling out, we'll also do a mailing to let people know about the changes.
The one other thing I just wanted to jump in and say was, I think that as far as finalizing the certification standards, I believe it will be the beginning of December, not November.
Yeah, I'm going to jump in. Hi, everyone. I'm Sophia Sa from the EOHHS. I believe the finalized certification standards will be sometime in December is what we were aiming for. Once, like Brenda said, we take all the comments and make any edits based on the comments, but we are aiming for December, yes.
I'm just chomping at the bit. Sorry.
Yeah, okay, thank you.
All right. Well, thank you, everyone. This is a great conversation. I looked forward to this all day. I appreciate the opportunity to talk more about conflict-free case management. Again, if you have questions, please send them our way. It helps us to think things through when you ask us questions. We want to make sure we've kind of thought of all the things we can think about. So everyone has a great day. And thanks again.
Bye. Have a great day.
Bye.
Have a lovely
Thank you.
afternoon, everyone.
Bye, everyone.
Thanks.